Hey guys, as always, I'm Sabrina, licensed massage therapist and certified cosmetic surgery specialist in Las Vegas, Nevada, and this is Las Vegas Cosmetic Recovery. And so today I want to go over one of the 5 keys. So in the 5 keys, it's nutrition, massages, compression, exercise, mindset. So today I want to go over massages. So now so I have made a video about when you're looking for the type of massage therapist, what kind of credentials that they need, and blah, blah, blah. Now I want to talk about the type of massages that you should be receiving. Now, if you've watched one of my videos on here about seromas, then you kind of already have an idea of a complication that can happen when you get the wrong massages done. Another big thing, if you get the wrong massages done, that could be just as bad as having a bad surgery. If you can go to the best doctor ever, and I've seen it countless times. You can go to the best doctor ever and get the bad, improper massages and have a horrible outcome. And then you're left with complications that need to be fixed and taken care of. And that can cause a lot of stress and a lot of problems. And at the end of the day, we want an easy recovery, guys, right? Watch my podcast, and then you can actually see a lot of different stories of people that have had the wrong massages done, and because of that, had many complications that resulted in having not a good outcome or not a good experience. So now, let's dive deep into a topic that I've been dying to talk about. Incisional drainage. Incisional drainage is a made-up word. Like, if you've watched my podcast with Ashley, and I'm going to put that link in the bio. Ashley is a fellow massage therapist in New Jersey who's also licensed, and she has talked a lot on her channel, and I will put her channel in the bio as well. She has talked a lot about incisional drainage, what it is, or squeeze massage. I think that's how she worded it too. Squeeze massage. All of the BS that comes with now being in cosmetic surgery therapy. So now, when you are, so like if you've watched some videos, you've seen girls reopening incisions with a Q-tip, reopening incisions with dental pick, whatever, it doesn't matter. They are opening incisions and then they're forcing fluid out, as you will see in the video above my head. There's a lot of people on social media that are forcing fluid out of incisions, even with seromas, which in another video I've discussed this a little bit. You might see in the video right above my head too, that some people, they like to poke a needle in someone's seroma and then push the fluid out of where they decided to put the needle, right guys? Wrong! That's wrong. That is not okay. And you know, one thing I love that Ashley said is that there is no massage police. There is no massage police. There's no the FBI of massage or the DEA or whatever have you. So you really have to be able to make these proper decisions for yourself by doing research. Like if you're watching this video right now, you're doing your research, you're discovering what kind of massages you need to be getting. So a lot of doctors, like in Miami, in Colombia, in Texas, they tell their patients that they need to have their seromas, or not seroma, they need to have their fluid drained out of their incisions. They need to force fluid and push fluid from up here down and force it out of their incisions. They are constantly reopening their incision and forcing fluid out of there. So now, I don't want to just come on here and tell you that I don't agree with this and that it's all bullshit, because at the end of the day, what I love that Ashley said in our interview too is that whatever you believe is true. There's science which lies in between that. And that's why I'm here at my desk. That's why I have my computer. So why don't we look up the stages of wound healing, guys? Okay, so let's ask Gemini the stages of wound healing after surgery. Perfect. Why don't we go there? Okay, so now there's 4 stages of surgical wound healing, okay? So there's 4 stages of surgical wound healing. There's hemostasis, minutes to hours, inflammation, first few days, proliferation, day 3 to week 3, and maturation and remodeling, weeks to months, possibly years. So now, what are the stages of wound healing? So hemostasis, stopping bleeding via clotting. Inflammation, immune cells clear debris and fight infection, causing redness, swelling. Proliferation, new tissue, blood vessels, and collagen form, rebuilding the wound. And maturation, remodeling new tissue, strengthens and reorganizes, improving scar appearance over weeks to months. These phases ensure the wound closes and regains strength, with each step building on the last for full recovery. Okay, guys. As I'm telling you about the stages of wound healing. Now, what happens when you're constantly reopening a wound, preventing the wound healing process from happening? So let's ask Google Gemini real quick. So what happens when you reopen a wound and prevent the healing from happening? So reopening a wound and hindering its healing process significantly increases the risk of serious infection, chronic wound development, and severe scarring. This action breaks the delicate, newly forming tissue, causing the body to restart the inflammatory phase, which can lead to deepening tissue damage, increased pain potential, and in severe cases, wound dehiscence. Dehiscence. Okay, so now, as of what I just read, guys, one thing I love about Gemini is that it pulls all of the actual information from Google, like different text and websites. Now, this is where we talk about the science that lies in between truth and what you believe. Now, if you're watching this, you are doing your research and you're actually realizing that when you get this done, and if you actually paid attention to what I have said in this video, if you get incisional drainage done, it is very high risk of infection, seromas, fibrosis, scar tissue built up, which is fibrosis, and you can even end up making your scars look deeper, thicker. You can get with keloids, or hypertrophic scars. Do you want that? So in the 5 keys with massage, which is what we're talking about right now, incisional drainage is not okay. It's not good. And stay tuned, because I'm going to prove it to you. And as always, guys, like, share, subscribe, hit the push notifications for all things Las Vegas cosmetic recovery. Toodles!